Hello friends, hello family, hello everyone, in whatever categories and capacities that you're in. I salute you all, and I'm so glad and delighted to have you once again for the new episode. On this episode, we are going to look at how we prepare pediatric paracetamol elixir. Elixir, depending on how you can pronounce it. Here in Africa, most of how we pronounce the English terms or the words or how we read, it can be affected by our mother tongue and then our original language. So if I don't pronounce based on your expectation, please focus on the spelling. Okay, so prepare pediatric paracetamol elixir. One of our friends, one of you guys, had requested for extemporaneous preparation of paracetamol, either syrup, elixir, is something connected to paracetamol. Okay, so here is a presentation on paracetamol, and I thank so much for the request that you made. It made us look up to that, and here it is. The person presenting to you is by name Young Grace. I'm so delighted to have you, and I'm so excited to take you through this new episode. And I'm always glad that you support the channel, and it enables us make more videos. The more you support us, the more we make more videos, and then the more you learn, the more you get exposed, the more you appreciate the pharmaceutics, and then pharmaceutical preparation, official preparation, extemporaneous preparation, and other preparations. Okay, so in the field that we are going in the world today, we need to have hands-on. Most of the things we need to have the hands-on. Okay, we can start a unit, we can start manufacturing if we have a basic, right? From depending on the location we have, register your company, start your compounding, extemporaneous compounding, and then make sure that you follow the quality control and quality assurance measures of preparing. And then check out and do your trials, whether your products work. Do trials on a specific number on efficacy, do trials on the safety of whatever you're preparing, do trials on effectiveness of what you're preparing, and then do a number of things. By the end of the day, you are a big owner of a specific company. London was not built in a day, or we can say a family is not built on one day. A home is not built on one day. A mansion cannot be built in one day. Okay, so when we have the basics, we get exposed, and we are able to think outside the box. Okay, so we need the basics so that we can think outside the box on what we can do. We need to be job creators, not necessarily job seekers. Okay, we need to have something that we own as our own. Yeah, so, and pharmaceutics, the field of pharmacy, enables you appreciate hands-on, enables you appreciate what you can do as a person. What is it that you can do and help your community and help the world and transform your countries, transform the world. Okay, so Grapharm Academy comes in to guide you as you think through what you can do, what is that you need to do, how you can do it. We are here for you, and today we are here to guide you on how you prepare a pediatric paracetamol elixir. So let us look at what are the requirements that we need to have when we are thinking of preparing a pharmaceutical elixir or a pediatric paracetamol elixir. We need active pharmaceutical ingredient. Remember, this is a medicated preparation. So we need the active pharmaceutical ingredient, and that is a medicated compound. which is going to be our paracetamol. Can be powder, can be tablets, because we can crush the tablets. However, we prefer to have the paracetamol powder itself, because the tablets already have other excipients, binders, diluents, lubricants, and the rest. So we don't want to have a lot of impurities in our preparation. So we need to have our paracetamol, pure paracetamol powder without impurities, and should be approved. Okay, also, as you think along starting something on your own, also make sure you always follow the regulatory bodies and then the regulatory guidelines, so that you don't harm your patients, so that you make what is good and edible. Edible is like food. We always consider it in food things. Edible, something nice, something good. So something like that. Yeah. Other requirements that you need ethanol 96%, volume in volume. You need propylene glycol. You need chloroform spirit. We have a lecture on chloroform, how we can prepare chloroform spirit. Okay. Then we have concentration raspberry juice. We need it. And then invert syrup. We also have a lecture on invert syrup. Please check on to it in this specific channel. Amaranth solution, and then we need glycerin. Those are our requirements. Here comes the formula. What is our formula? In case we want to prepare 100 ml of this specific elixir, we use this formula. In case you want to prepare 200 ml, you expand or enlarge this formula. In case you want to prepare 50 ml of your pediatric paracetamol elixir, you reduce this formula. Okay, so we have a lecture on reduction and enlargement of the formula, but this is a basic formula you can use. Okay, paracetamol, we need 2.4 grams. Ethanol 96%, volume in volume, we need 100 ml. No, sorry, excuse me, not 100 ml. We need 10 ml. Sorry for that, guys. Propylene, guys. Ethanol 96%, volume in volume, we need 10 ml. Propylene glycol, you as well need 10 ml. Concentrated raspberry juice, you need 2.5 ml. Chloroform spirit, you need 2.0 ml. Invert syrup. Invert syrup, I already talked about it in a previous lecture. Please check into it in the specific channel. You need 27.5 ml, and then amaranth solution, you need 0.2 ml. Glycerin, you need sufficient to produce 100 ml. Okay, so that is our formula. Either you need 20 ml of this specific elixir, you reduce the master formula or the formula that is presented to you. Okay, so let us look at what is the procedure we need to follow when we are preparing this specific elixir. We mix ethanol 96%, propylene glycol, and chloroform spirit and make a mixture. You're going to get your 10 ml of 96%, 10 ml of propylene glycol, and then your 2 ml of chloroform spirit, and mix well. Okay, after you have mixed them, remember you will have weighed, you have measured. Okay, all of them are solutions, so you will have measured. We measure solutions. However, viscous solutions, we also weigh them. For example, glycerin, we can either weigh or measure it. Okay, so after you have done that, we are going to dissolve our paracetamol and shake it. We are dissolving in what? We are dissolving in the mixture we have made, the mixture of ethanol, propylene glycol, and chloroform spirit. After we have dissolved our paracetamol and shaked it, we dilute the concentrated raspberry juice with invert syrup. Remember, raspberry juice and invert syrup, we can prepare invert syrup. Okay, so we dilute it, it comes as a viscous juice. So we dilute it with our invert syrup. After we have done that, we add diluted solution of gooseberry juice in the paracetamol mixture. Okay, after we have diluted or mixed them, mixing the paracetamol that we already mixed in ethanol, propylene glycol, and chloroform, we now put the juice and we dilute the juice, that is the gooseberry juice, or juice, guys, juice, with invert syrup. Like I said, how we pronounce some of these things is based on our mother tongue. Here I can say juice, I don't know, based on how you pronounce it, guys, but focus on the spelling. It is juice. Yes. And then after you have done that and mixed, you add amaranth solution and shake me. Remember, amaranth solution is coming in as our coloring agent. Okay, so and mix. After we have mixed, we add sufficient amount of glycerin to produce 100 mils. So remember, glycerin, we just add sufficient amount after everything has been mixed, and then after that we mix them all and make a uniform mixture and pack our product and label the product. Okay, you know the different parts of the label, you know how we can pack our products, majorly solutions and syrups, elixirs, and the rest. However, we need to note something. We see that this specific preparation is a category of analgesic and antipyretic. So antipyretic, what comes into your mind when you hear the term antipyretic? What rings in your mind? Analgesic, what rings in your mind? What is analgesic used for? Or another term we can use for analgesic, a layman's understanding term for analgesic, and then antipyretic. The dose we give 5 mils to 10 mils according to the age of the patient. That's the age of the child. Remember, it is a pediatric dose. Remember, pediatrics we are dealing with children. Okay. However, pediatric elixirs should be diluted. It comes as a viscous preparation. Whatever we have been adding, the invert syrup, the raspberry juice. Yes, the raspberry juice are all viscous preparations, and since they are viscous preparation, you dilute it before you give to a child. Okay, so make sure that when you are dispensing, you give instructions to patients and make sure they dilute the preparation. Storage, preserve in a well-closed container and protect from light. Use analgesic and antipyretic. And then weight per mil, we always have 1.210 to 1.230 grams per mil, each meal in a preparation. So we have questions here to answer, just to check whether we understood the previous slides, the previous explanations. They're asking us, what is paracetamol? How will you prepare paracetamol elixir? So here they're asking you for the procedure for preparation of paracetamol elixir. So when you ask for the procedure, you can also give us how the formula is, what are excipients, and what is each role of each excipient in a preparation. And then define analgesic and antipyretic activity. And then what is the use of propylene glycol in our preparation? Key pharmaceutical applications of elixirs. So try to have like 2 minutes and try to answer these questions. In case you get stuck anywhere and you want maybe some clarifications, please outline it in the comment section so that we dive in more and understand more, so that we all appreciate the field of pharmacy, the field of pharmaceutics, the field of preparation of medicine, extemporaneous preparation, because you as a pharmacist, a pharmacy personnel, a pharmacy technician, a pharmacy assistant, you need to be in position to have an idea or to know how to prepare extemporaneous preparation, because most of the prescriptions may require you to prepare compound. You have all the reagents in your pharmacy, and then you have to prepare the based on what the order from the prescription. Okay, so you need to be well equipped and knowledgeable on what to do, how to do it, what each reagent does, what each excipient is doing in preparation, how long a patient should take the medicine, how should a patient store, write a suitable label for that specific patient that you have been guided to prepare. Okay, so Elixir, I need to give you some hint on what elixirs are. We just went without the theory. I think people were wondering what are elixirs. In case you were wondering what it is, elixirs are clear, liquid flavored, alcoholic or hydroalcoholic preparations intended for oral use. They contain one or more medicaments. The one we have looked at only contains one medicament. Okay, pleasantly flavored, usually attractive color, containing high proportions of alcohols, or sucrose, or a suitable polyhydric alcohol together with a suitable additive. An example of a polyhydric alcohol that we looked at, we have a dihydric alcohol, that is propylene glycol is a dihydric alcohol, and then a trihydric alcohol or polyhydric alcohol is our glycerol. If you look at the structure of glycerin, we see that it has the 3 hydroxyl groups. If you look at the structure of propylene glycol, it has 2 hydroxyl groups, together with suitable additives, including antimicrobial agents. The alcoholic content in elixir vary from 5% to 40%. In general, they are more stable than mixtures, as sufficient alcohol is added to maintain the drug in solution. Most of the elixir become turbid when moderately diluted by aqueous fluids. Okay, we have types of elixirs. Elixirs are mainly of 2 types. We have the medicated elixirs and the non-medicated. The one we have just prepared, that is paracetamol, pediatric paracetamol elixir, it is a medicated elixir because we looked at the analgesic property and the use of paracetamol, as well as the antipyretic property or use of paracetamol. So we see that the non-medicated elixir, they are used purely as diluting agents or solvents for drugs containing approximately 25% volume in volume alcohol. For example, we have a simple elixir, isoalcoholic elixir, or a low alcohol elixir that is containing 8 to 10% alcohol solution. You can also look at it as really low. When you look at the 8 to 10% alcohol concentration, we see that it is low. Yes, and then high alcoholic elixir, where we have containing 75% to 78% alcohols. Medicated elixirs, they are elixirs containing therapeutically active compounds are known as medicated. For example, the paracetamol, pediatric paracetamol elixir is a medicated elixir. Okay, congratulations upon reaching the end of this lecture. Thank you if you came this far listening to this lecture. I congratulate you and I thank you so much for supporting this channel in making more videos like this. I want to thank you and send regards to the person who asked for the paracetamol preparation and then simple syrup preparation. Thank you so much for the request you made. I hope this answers your request. And in case there is any other thing you have not got from what we have tried to get back to you, please still reach us in the comment section, and then we handle it. Okay. Thank you so much. I appreciate pharmacy. I appreciate hands-on pharmaceutical preparations, and I appreciate the industrial field of pharmacy. And yeah, keep tuned. Keep on. Thank you so much. I wish you all the best, and stay blessed.